of the Ministry of Health. And this is the role now
But
devolved
you are
to
their
the
customer.
Yeah, I also have, I must take care of my members.
Yes.
So my office has also visited these hospitals and to find out how it is. And we work in liaison with the Ministry of Health and now with the county government.
The reason why I'm asking this is because I've seen a lot of ambulances which are donated by NHIF. So I'm saying instead of giving ambulances, why don't you, for instance, maybe provide beds, sheets? Because there are some hospitals you go, the sheets are not there. The dressing for patients is not there. There is no soap to wash even the hospital. The hospitals are in pathetic situation. And how do you ensure that? I don't want to go to such a hospital.
Well, what we'll do, you know, we have a whole department that looks at quality. And
how do we enforce that to make sure hospitals are hospitals? You don't tell me to go to a place which is not a hospital, but a name.
we ensure that we go there and we actually have a marking and, you know, a marking sheet, and we find out and we bring to the knowledge of the hospital management. Mind you, the ministry also has the power to close hospitals that do not provide healthy conditions, because it's very sad when a health facility is not healthy. I mean, that surely is a big problem. But we look into that.
There's a place which are careless.
Somebody disagrees with you about doctors, that a lot of doctors are leaving public hospitals. So they say your facts are not right. This is a doctor, actually, Dr. Peter in Embu, saying your facts are not right. A lot of doctors are quitting hospitals, I think because of what Mutegi said, this devolution being taken to the counties.
I was told, in fact, in Bomet, in one hospital, a journalist told me one hospital, since devolution came, they went and moved all those fellows who are not from there.
Why? What has devolution done to them?
They don't want to put under county government.
They want their own people. If you're a hospital administrator or doctor or whoever, you are removed because you're not from there.
I am sure the governors and my cabinet secretary, Minister of Health, is hearing to that. Because, well, the facts I know, because we also visited these hospitals, I have not really, maybe one or two, but en masse is, the word en masse is
even before devolution, doctors were leaving this country to South Africa. We know this for fact, or to UK. Nurses were leaving to UK because of the way they are treated by the government. They are paid. If a doctor is qualified after many years in the university and you get 30,000 shillings, you don't want to be a doctor here. You can be a doctor elsewhere.
These are the conditions. These are the conditions I'm now getting to understand. Let me have as many NHIF members, so that I can. Let me have as much, because I think all these things are interrelated. I agree with you that if you go to a facility and you don't get the service you deserve, it is a disincentive for you to be an NHIF member.
Don't you remember there was a time Kenyatta Hospital used to be so horrible that people didn't want to go to Kenyatta at all?
But now they're
improved.
But also, Mr. Kirgotty, the logistics of using the NHIF card. The service, when you go to hospitals, like for example, somebody says they go to Kenyatta Hospital, and you find a lot of people there, you have to get a form and, you know, customer care, if I may say so, service. Looks like there is a big problem there, because I'm seeing a lot of feedback, people saying, you know, they went here but they didn't get. Others say they went to hospitals, as we said earlier on, hospitals turned them away because of non or late payment to those hospitals, which affects their cash flow. Quite a bit of a problem there. Of course, others also say they congratulate NHIF, they've done quite a bit. I mean,
and those are the ones you should highlight more. Because we've come a long way. What I know, and for the last 1 year, I deliberately opened a lot of window offices in many hospitals. Like Kenyatta, we now have almost a full branch of NHIF. So, and they say, you NHIF member, report here before you go. So they go there. We are not segregating Kenyans, but you go there, you're NHIF member, and then you are given, you know, first lane. Then payments also, you know, now we calculate these payments on a daily basis, as soon as, you know, so that I don't see how payments can be delayed, because we know by the end of the month you had the following members. So
yeah, they're asking, somebody's asking, have you remitted money under the civil servant scheme?
Yes.
Somebody says they were turned away last month. This is George in Migori.
Yes.
Yeah, that NHIF has not remitted the money.
No, we paid. We paid by the, I think the 4th of this month.
Yeah.
I remember I had actually said by the 1st of every month we will have paid these facilities. But sometimes Treasury or the ministry delays in remitting the funds to NHIF.
Yeah.
So, you know, we are one government.
So there are some logistical delays there, but things have been...
Oh yeah, it is.
Okay.
And if there is any facility that has not been paid, can I know about it as soon as I leave here and go to my office and check?
Okay.
Yeah.
Problem is that most hospitals give you prescriptions to buy medicine outside when you're an inpatient. And then you come, you know, what should happen? Because this is going on. Doctors diagnose you, they admit you. Then there's no medicine. They say, this is what we need here.
It is wrong.
And you have your NHIF card. What should happen?
It is wrong, brother. It is wrong.
Should they report somewhere? Or what is the recourse left to those people who are going through this? Because it's happening.
They should report, and I am sure my officer, my surveillance officers, I have inspectors who go there. They should report and say this particular facility, you know, does not give out drugs. And then we'll find out the reason why.
I know of a relative who went to Kenyatta Hospital.
Yes.
She has some skin disease.
Yes.
And she was prescribed a drug, 320,000.
Yes.
NHIF said, no, you can't pay that. She's a civil servant.
A civil servant?
Yes. 320, a drug. 300, I wonder now, what kind of drug is this?
I don't know. Was that person referred outside the country?
No, Kenyatta, to go and buy from outside. I don't know.
I'll get the details there. And then,
yeah. Okay, I think in general there is a bit of appreciation of what NHIF is doing.
Thank you.
I think there are just gaps here and there in terms of hospitals, different treatments that people get in different hospitals. Some have issues with the NHIF card. Some say they need a letter. In fact,
that issue of the letter, that issue of the letter actually is good. Someone has raised it. The NHIF card is sufficient. You don't need to refer a patient to NHIF to bring a confirmation. Yeah. The only other thing that happens is that people change their dependents so often. I really don't understand that. Munakosana, you delete some of those children from NHIF.
You put others.
You put others.
Yes.
So when you go there, maybe the hospitals have not updated it the way we have. So the hospital tell you go back to NHIF, and so that frequent change of dependence is a problem. But there should be no reason why one should be told bring a birth certificate, bring this, because by the moment
get a letter from your boss.
to say you are still employed.
Yeah.
No, but for us, as long as the remittances are still there, we don't want to know whether you're working with Exec.NHIF or whatever.
The hospital want to know.
So that, but now that we are going to inform you, tomorrow when you leave this place, and you be remitting your, you know, your contributions normally. It will not have any difference whether you are in formal employment or in informal employment, and that's the way we want to.
Does the card cover operations? That's normally the case.
Yes, in the government hospital. Even
there are people who are saying they went in, but they were told no. Somebody went for diagnosis, I think in Meru, for cancer, prostate cancer diagnosis. They were told that's none of our business.
My God.
Other places they have been admitted. You are recommended for operation by a doctor. The card cannot cover that.
No.
Yeah.
No.
So
no.
I think it's also a matter of awareness, but
awareness by hospitals.
By hospitals, which are not doing a good job of it.
I think I will have to call them.
So perhaps as we wind up, you know, what is it that you want to tell the public? Because this is you're starting something great this week that will cover the whole country. Everybody's keen. Healthcare is really core in this country. So what should people expect, and what are you calling on them to do?
Thank you. I am appealing to all Kenyans to register as NHIF members, whether you're in formal employment or in informal work. Whether you are a juakali artisan, whether you are a farmer, you are free to join National Hospital Insurance Fund.
And the fees,
the fees is only 160 shillings per month. That is 1,920 per year. And then you get comprehensive cover in government hospitals, faith-based hospitals, that's mission hospitals, for all the diseases. We are rolling out a big informal sector awareness tomorrow at Kibera with His Excellency the Governor of Nairobi, Dr. Evans Kidero. Thereafter, I will go to the various counties with a program that the governors will give, so that we can register as many Kenyans as possible. So my appeal is they turn out in big numbers. We will, the national one, we will have so many other NHIF stands that we will register people there and then give you cards, but the process will continue in all the counties.
Let me ask another question before we close. If I have an insurance with other companies, the medical, the people who insure medical, that does not bar me from joining any.
No. You see, normally even in these other medical, you know, they use NHIF as a point of call. When you go to any hospital, you have NHIF card, and then from there,
then the rest.
There it is. But somebody has suggested that you need to engage a marketing team to go out there aggressively the way other insurance companies do, so that you can recruit as many members as possible, so that, and also to enhance awareness of the public about this insurance scheme.
That's a very good idea, and I accept that, and I have begun with you. And here, if you will register all your brothers.
Thank you so much, Mr. Kirgotty, for coming.
Okay, brother.
And wish you the best.
Okay.
That is it. Go out there, register in the National Hospital Insurance Fund, so that you can have your medical problems taken care of when you go to the district hospital or the mission hospital. Keep watching Power Breakfast.